My Academy of Health Excellence. The Empowering Benefits Association has the solution for the healthcare crisis. Instead of health insurance, we've developed Health Excellence Plus, a healthy care strategy to help you improve your health while controlling your healthcare costs. Through an innovative layering of healthcare services, individuals and families can access high-quality healthcare that is affordable, flexible, and effective. 2 of the 5 healthcare services, Avoid and Contain, are found in all plan options. Contain with medical cost sharing, Mitigate with 24/7 telemedicine advocacy, Manage with Health Savings Account or an HSA, Prevent with minimum essential coverage or an MEC, and Avoid with Wellness, My Academy of Health Excellence. The foundation of the strategy is the My Academy of Health Excellence state-of-the-art wellness program designed to get and keep you healthy to avoid medical expenses. However, when an accident or illness does occur, should you need help paying those expenses, it's nice to know that you're part of Sedera Health, a medical cost-sharing community to contain and pay them. Here's Dr. Charles Benz to share the highlight of this amazing program that, when combined with other elements of the strategy, puts you back in control of your health without risking your wealth.
There is nothing as important as good health. Now there's actually an excellent overall strategy for achieving good health, including a low-cost healthcare plan. Our healthcare system treats symptoms with drugs and surgery while practically ignoring prevention and the reversal of chronic disease. Did you realize that over 80% of disease is preventable, and yet our healthcare system only spends 5% of healthcare dollars on prevention? Doctors get paid to treat disease, not prevent it. Prescription drug cost is high because the drug companies lobby the government to keep it that way. Other governments around the world would pay much less for their drugs. There are no incentives for doctors, nurses, drug companies, testing labs, or anyone else in the healthcare system to keep costs down by preventing illness and getting people to be healthier. I'd also like you to consider, are you healthy on purpose or by accident? Many people feel that illness just happens due to their genes or something else that was beyond their control. This is simply not true. We have an amazing degree of control over our health, and the decisions we make every day determine how healthy we really are. Over 60% of adults aged 18 to 65 already have a chronic illness. This was only 10% 60 years ago. The main reasons are nutrition and toxins in the air, water, and our food. Here are some facts about disease that you may find interesting. 70% of adults are overweight or obese, which contributes greatly to the many chronic diseases. 97% of people who try to lose weight fail because they use fad diets, not evidence-based science. 50 years ago, 1% of adults were diabetic. This has increased to 45% for every child born after the year 2000. It's also interesting to note that 80 to 90% of type 2 diabetes is preventable and often reversible. 90% of people who try to quit smoking fail because doctors don't seem to know how to remove toxins from the body and change the brain chemistry of a person to allow them to not be addicted anymore to the dopamine they get from the cigarettes they smoke. 80% of all chronic illness is preventable, including heart disease, stroke, and cancer. Do you really know how your body works in order to become healthier? Disease does not just happen by accident, and good health doesn't happen by accident either. If you want to be really healthy, you will need to work on it a little bit every day. Good health depends on 6 key factors: nutrition, exercise, stress management, toxin reduction, sound sleep, and genetic awareness. What can someone do personally to lower their healthcare costs? The very first thing that someone can do to lower healthcare costs is to take responsibility for their health. This begins with an open and honest assessment of exactly how healthy you are right now. I'd like to raise nutrition as the question in that regard. The National Cancer Institute surveyed over 16,000 people aged 2 to 80, and they could not find one person with a truly healthy diet. In fact, most people were deficient in 11 out of 14 nutritional categories. Another thing to do is to get your genes tested with a test like 23andMe, not the ethnic one. This is the one that measures your probability of chronic disease. This will provide an accurate picture of your genetic profile and the possible development of a chronic disease sometime in the future. Genes represent a predisposition for disease, not a guarantee, so you have control over it. Finally, take advantage of a very unique technology called artificial intelligence based on functional medicine. This tool will allow you to answer questions based on health risk assessment, put in your blood markers, add your genetic influence, and produce a personal health improvement plan. This is the most accurate health plan you will ever get, and it is like no other plan for any other person. My Academy of Health Excellence has all of the traditional wellness tools and elements you may be familiar with, but for the members who are serious about their health, we have a state-of-the-art artificial intelligence platform based on natural functional medicine. Ask yourself these questions, please. Are you willing to take firm control of your health through education about prevention and treatment programs with natural, functional, evidence-based medicine? When you do need conventional medicine for operations and prescription medications and other traditional health services, do you want the best services and products at the lowest possible cost? Would you be interested in working with a team of health practitioners, coaches, and wellness advisors from my Academy of Health Excellence to take full advantage of the unique services and products that they have developed? And are you willing to make the important lifestyle changes which are recommended when you use our artificial intelligence platform based on natural functional medicine? This is the only totally personalized health platform focused on self-care that has ever been developed and proven to be successful with over 20,000 users over a 5-year period. If you answered yes to the previous 4 questions, then you are an outstanding candidate for this proven program to achieve health excellence. Join the thousands of others like yourself who've decided to take control of their health and use the most advanced health prevention and treatment program available today while lowering your cost by as much as 30 to 50%.